So I'm the last presenter today, but now I start to run fast because my clinic is a little bit long. And let's take a look at my logbook structure. I try to include almost all the endodontic therapies inside my logbooks, ranging from the vertebral therapy to the endodontic surgery. And I try to pick 3 of them to show you today. The first case is the 12-year-old male patient. He was referred to me by an orthodontist. He presented with the pain of the quadrants number 2, 3, and 4. And as you can see in panoramic X-ray, the radiolutions here are tooth number 4, 6, number 3, 6, and extensive caries of the tooth number 2, 6. And with the clinical finding and radiographic finding, the diagnosis was established as follows. The tooth number 4, 6 and tooth number 2, 6 were symptomatic irreversible pulpitis with a symptomatic apical periodontitis. And tooth number 3, 6 is the previous treated with symptomatic apical periodontitis. And with this diagnosis, the treatment plan of mine was trying to keep the vital pulp of the tooth number 2, 6 and 4, 6, and to do the root canal retreatment with the anterior plaque for distal tooth of number 3, 6. For the tooth number 4, 6, as you can see in the CBCT, the large lesions around the distal and the middle root. And after remove the coronal pulp tissues, the hemostasis was achieved within 10 minutes. So I go forward with pulpotomy, and the bidentin was placed, and after that the final restoration with composite. The direct composite restoration afforded the essential life from both hematoglycine. And this is the 3 months and 6 month finding on CBCT. And this is the 12-month follow-up. And in this image, you can see the completely healing of the periodontal lesion. And you can compare the preoperative and 12 months follow-up of this tooth. And for tooth number 2, 6, I trying to dye the dentin with the dentin of the caries indicator to be sure that I can remove all the infected and affected dentin. And after remove all the infected and affected dentin, the pulp tissue was exposed, and I can control the bleeding within 10 minutes. So I go forward with the direct pulp capping with bidentin and the final restoration with composite. And this is the CBCT after 12 months follow-up. And you can see, and you can compare the X-ray, the CBCT preoperative and 12 months follow-up. You can see here the sinusitis was resolved with the vital pulp therapy, and you can see in the axial cut, the dental bridge was formed. And for tooth number 3, 6, I did the root canal retreatment. And for the distal root, because of the open apex, I did the anti-apical plaque. And this is the result after 12 months. And for this case, because I'm blue, so I always ask everyone and ask myself, why? So in this case, for number 4, 6 and number 2, 6, the vital, both two teeth were response positive to the vital pulp test. So that's why when I can touch the vital pulp, I will keep it vital. And this is a treatment option very good for the irreversible pulpitis, even in the case that you have the periapical lesion on X-ray, because sometimes the periapical lesion, periapical radiolution you can see on CBCT is just the immunological reaction to the cytokine and mediator from the pulp tissue from the infected tooth. In my second case, 22 male patient came to see me because he cannot afford the dental implant. And you can see the CBCT is that. And the diagnosis was established of tooth number 16, symptomatic irreversible pulpitis with normal apical tissue, and root retained of 47 and 36. And my treatment plan is for tooth number 16, a single visit root canal treatment, and for root retained of 47 and 36, I would love to do the auto transplantation. And my plan is to extract the wisdom tooth number 48 to transplant into the socket of 47 and to extract the wisdom tooth number 18 and to trans into the socket of 336. The treatment followed by the root canal treatment and full crown restoration for 2 transplanted teeth. And this is the image clinical for tooth for root retained number 47. And after a traumatic extraction of tooth 48, I transplant into the socket of number 47 based on the CBCT calculation. And this is the post-operative transplantation. And after 2 weeks, the fixation of the tooth is just by the suture, and the composite filling attached into the next adjacent tooth. And after 2 weeks, I did the single root canal treatment and followed by the full crown. And this is the 2 months follow-up CBCT. And for the other side, I do the same procedure. But in this case, because the morphology of the root is different, is quite different between an upper wisdom tooth and lower molar. So I try to print the 3D replica to prepare the socket to reduce the surgical time. And this is the clinical image after 1 week. And this is the CBCT post-operative. And after 2 weeks, I did the single visit root canal treatment and followed by the full crown restoration. And this is the 2 months follow-up CBCT. And you can see this is 8-month follow-up CBCT now. And you can see the bone is healing. The bone is regenerated. And this is the panoramic. And you can compare the clinical image and the radiographic image preoperative and after 8 months follow-up. And through this case, I would love to say that the auto transplantations is a chance to preserve the natural tooth of a young patient, of young adult, when they still have the wisdom, and even they still have the immature wisdom tooth, is a good chance to preserve the natural tooth. And the last case is the management of necrotic immature permanent tooth with symptomatic apical periodontitis using regenerated endodontic procedure. And this is the case that I heard this morning, the same procedure with ESE with 2 appointments. The first appointment, I did the minimally invasive cleaning shaping with 3% sodium hypochlorite and ultrasonic activation. And for the second appointment, I initiate the bleeding, and I have the blood clot under microscope within 10 minutes. And after that, I place the biodentin, and after that, the final restoration with composite restoration in 1 visit. And this is the result after 6 months, 12 months, and 18 months. And this is the 24 months. So you can see in comparison to pre-operative and after 24 months. And that is all of my presentation. I'd like to enrich me with your knowledge and with your experiences in Endo. And thank you everyone for listening.
Thank you. You have seen me going to the committee because we were, of course, we've seen amazing presentations today from all of you guys. Like you started saying you're a minivan, but for us you're not mini at all. You're a big van, and we are very like. Yes, I saved the best for last. Yes, really congratulations. If you have, like, you've been my student at my courses, if you ever decide to make a course about this, I'll be very happy to lead you. Congratulations. We will take a 15 minutes break, so at 4:20 we will have the graduation ceremony. Ciro, can they start selecting the gowns? No, or you will give it to them?